Good afternoon, everybody. It's Wednesday, time for Wisdom Wednesday. Hope you all are doing well. In the last several weeks and even days with patients here in the office, we're just seeing a little bit more in the terms of patients coming in complaining of fatigue and disrupted sleep, in addition to just stress issues. Now, we know that out in the world today, we've got all kinds of things going on that are contributing to a lot of our stress. We're having to pay more at the pump. Inflation concerns are going up. And in addition to all that, just living our lives can be quite stressful. So I thought, even though we've talked a little bit about stress in the past, I would kind of devote a little bit specifically to what happens physiologically when we have this chronic stress response over time. We know that most hospital visits and doctor visits can be boiled down to some type of stress issue, and it can manifest in many ways: heart disease, depression, anxiety. We know that a lot of our cognitive issues and increasing problems with Alzheimer's and dementia may be associated with long-term stress. Cancer, digestive issues, many things can be, as we peel back the onion, can really be targeted at a stress response of some sort. So I think we need to understand what can happen at all levels of the body. So I thought I'd kind of walk through that with us today, and then maybe look at a few things that we can do to help reduce some of our stress, or at least get some tools in the toolbox. And I know we've talked about these, but I think that it can really be helpful again to revisit some of this. So let's look at what the effects of chronic stress, this stress response, this release of cortisol, and of course, whenever cortisol is released, the counter-regulatory hormones go along with that: epinephrine, norepinephrine, and glucagon. And the epinephrine, norepinephrine, the adrenal, the stress response really is attributed to that. And then the glucagon can raise blood sugar, which for many people who struggle with weight loss, living in chronic stress keeps blood sugar up, which keeps insulin and insulin resistance always at the forefront. So having tools in that area can be helpful as well. So let's start at the top. So brain and nervous system, when we have chronic stress, what are the responses that we see? Well, it obviously activates this fight or flight response. We also see damages in areas of the brain that are responsible for cognition and for memory and for learning. Certainly, I know when I'm stressed, it's very challenging to be able to focus and to learn and work through a lot of things that I like to do, which is listening to podcasts and trying to lay down tracks of memory and understanding and those types of things. It also increases our risk for Alzheimer's and dementia. So lowering stress can hopefully help reduce that. As far as the heart is concerned and our vasculature is concerned, we know that when there's this chronic stress response, it raises blood pressure, it increases heart rate, it increases risk for high blood pressure, therefore heart disease and stroke. So we certainly can see that. The respiratory system, it can increase shortness of breath, which can then worsen COPD or asthma for folks that are predisposed. It can also have us breathe more shallowly. And that's a really important issue as far as just overall health is concerned too, and just getting oxygen to our organs. That deep breathing is really a wonderful way to offset some of the stress response that occurs. But decreasing oxygen to all our vital organs is really problematic. And one of those vital organs in particular is the gut. Reducing the ability of getting oxygen and blood to the gut, particularly during digestion, can be quite problematic. It can trigger pain, digestive pain. It can trigger gas and bloating and nausea, loss of appetite. Of course, we know that with chronic stress, but it can also trigger a lot of the autoimmune disorders of the gut, ulcerative colitis, Crohn's disease, and a lot of the irritable bowel type symptomatology. The stress response really initiates in the adrenal glands. So it releases cortisol, which is one of our stress hormones. And this long-term elevation of cortisol is what increases this risk. So it is definitely coming from the adrenal glands, those tiny little glands that sit on top of our kidneys. It can affect the musculoskeletal system. You can get lactic acid built up, which causes muscle tension and tightening. You get tension in our musculature, particularly in the neck, which can increase risk for headaches and migraine type responses. It also can affect reproduction. Stress response for a lot of men and women. It can lower sperm counts, but it can also lower libido and sexual response, menstrual irregularities, and significantly increase premenstrual type symptomatology for women. So all up and down the entire body, this stress response can affect all organs and all organ systems. And as a result, we have these long-term chronic diseases, which are all preventable. Certainly we've talked a lot about that, but understanding the stress response and then those things that can cause a stress response. Well, we know that significant losses can occur, traumatic events, loss of a loved one, loss of a job. Certainly the last 2.5 years with COVID has been markedly stressful. Managing chronic illnesses, finances, we know that's an issue. Social isolation, we're seeing more and more of that, and more of folks on social media, which can only increase anxiety. We see a lot of conflicts in relationships, as well as high expectations as far as work with multitasking, etc. So a lot of these things can contribute to stress. We know that the generations that are coming up we're seeing more depression and anxiety than we've ever seen before. So it's really going to be helpful to have some tools in the toolbox. We know that exercise obviously can be exceedingly beneficial to disperse some of this, certainly muscle tension, getting good blood flow to the brain, helping distribute good oxygenation throughout the body is very beneficial. Deep breathing, we've talked about the 4-7-8 breath or the square breath, just deep breathing overall, but breathing through the nose is particularly important. Getting enough adequate sleep, making sure that you're exercising but not doing too much, because that can in and of itself be a stressor to the body, doing too much work. We know that journaling and meditating can be exceedingly important. Making sure that you socialize and develop a community. The research work that's been done with people who are in community has been overwhelmingly positive. So isolating yourself and not getting out can be really just adding more and more to that chronic stress response. I find that just writing things down of things that I need to do is quite helpful, so that I don't have that stress of having to remember things or taking care of something at the moment. Writing it down or sending messages at the moment can be helpful. And just staying away from your devices for periods of time is beneficial. Making sure that you don't charge your devices in your room, trying to get those outside, trying to stay off devices, say after 6 or 7 p.m. can be helpful, or just taking a total detox from all devices is very helpful. And just doing some self-care, finding ways that work well for you, things that are beneficial. I love going to the cryo and sauna and doing red light therapy. I love getting massages. These kinds of things are something that I work into my schedule just so that I have personal time, because I tend to not do well on my own if I don't have things like that plugged in, so that I have this sort of forced time to just breathe and do that type of work. So hopefully that's beneficial and giving you some ideas of things that you can do. There are definite programs out there that you can sign up for. There are things that are just mindful-based stress response courses. There's cognitive behavioral therapy. But if you really struggle with anxiety, I think that having some tools in your toolbox are really important. And I hope and encourage you that you will look into some of these things. You guys have a great week. Take a deep breath. Blow it out. So that 4, 7, 8 breath is just put your tongue behind your teeth, which opens up your airway. Breathe in through your nose for a count of 4. Hold it for a count of 7, and then out through your mouth for a count of 8. 4 times, a couple times a day, does wonders for that parasympathetic side of your nervous system, or that rest and digest, to lower that fight or flight. Have a great day. Next week, we'll talk later.